welcome to our lecture. We are going to be focusing on what we call CSR, or also what we could be able to call corporate social responsibility. So by the end of this particular lecture, we will be able now to define what is corporate social responsibility and its relevance for healthcare organization. We will also be able to identify a number of drivers and challenges of corporate social responsibility in the healthcare. You will also be able to have the ability to analyze various benefits and risks of corporate social responsibility initiatives for healthcare stakeholders. And also you will have the ability to evaluate the ethical and social implications of corporate social responsibility practices. And also you will also have the ability to apply corporate social responsibility frameworks and tools to design and implement CSR strategies. So it is quite an engaging lecture. I invite you to be able to follow up to be able to understand various concepts in corporate social responsibility. So we begin by defining what is corporate social responsibility. And we are saying it's all about the commitment that organizations will have towards the community. And these commitments are in relationship to be able to improve the quality of life for that particular community, make the community feel that this particular organization is here not just to gain money from us, but also to help us also benefit with their services. And it's very important to know that corporate social responsibility is a voluntary or it's a free contribution to the society. So corporate social responsibility is very important. It's an aspect that we cannot afford to ignore as organizations. Of course, no one is holding the gun for us that it is a must we do it. Yeah, but we need to have considerations also to know that as organizations, we will also have a way that we are going to be benefiting from corporate social responsibility initiatives. So it is something that every organization needs to sit down and see whether it is doable based on the services that they are offering. And now they could now be able to make this particular decision to engage in corporate social responsibility activities. So that will be our major discussion across almost the entire lecture. Of course, in between, we will also look at various other concepts around corporate social responsibility. Now, so what we are calling CSR is a short form of corporate social responsibility. Yeah? So we are asking ourselves a very important question on why is it needed? Why is corporate social responsibility needed in health? So that's a very good question, even as we start the discussion to understand on the reason why. And number one is because of various global health challenges and complexities. We have already said that corporate social responsibility is all about giving back to the community. So why should we do that? So when we talk about global health challenges, we are talking about challenges by infectious diseases, challenges caused by pandemics, like when we talked about COVID-19. Very many countries were not fully able to provide the financial support to their citizens. So there are other developed countries that came in handy and provided this financial support. So that would also be part of corporate social responsibility initiatives. So when we have these pandemics around affecting communities, then as an existing healthcare organization, what is it that we can do? I am sure during that period, even organizations participated even in a simple, what we would call a simple task of distributing masks to communities, carrying out education on how they need to wash their hands, and so on and so forth. So, and also we could have global health challenges in relation to non-communicable diseases, issues to do with heart diseases, cancer, diabetes. We could have organizations that are coming on board to support initiatives around those non-communicable diseases. Across the world, we would also have challenges because of inability for individuals to access quality healthcare. So, as healthcare organizations, as other organizations in the world, what is it that we can be able to do so that we reach on these communities and support them? That one is very, very important. And also, as another health challenge, maybe it is around the issues of child mortality rates. Maybe we would seek to provide community solutions to such issues. And currently, we are also having conversations around mental health. What can our organization do in relation to mental health activities? So CSR is important because of all those health challenges that I have highlighted there. Another reason on why we need CSR, what we have said, it's corporate social responsibility. It is because of the aspect of limited funding uh, and 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 resources for healthcare. Globally, we could have healthcare not very well funded. Of course, every nation has other things that they also want to do. So, because of this particular challenge, then social responsibility comes in handy, because if you are looking at the government perspective, ideally, if we leave all matters healthcare to the government, they may not be able to meet all of them. So, as healthcare organizations, then we can come in handy and provide whatever we feel are solutions to the communities as part of giving back to the community and as part of filling the gaps that are there because of funding and resource constraints. Another reason why we need CSR in health is because we need to establish sustainable healthcare systems. We want to build systems that are going to last. We want to build systems that are going to serve very many people. And that's very, very important for us now as healthcare organizations to come on board and assist building these systems. And finally, corporate social responsibility is in health is important because it is going to assist us improve the quality of life through CSR activities in health. So we are able to improve people's lives. I've just talked about non-communicable diseases. Maybe once we provide nutritional advice, maybe for diabetes patients in a community, we are helping them live a better life by getting to understand things that they did not know about the kind of food they need to take if they are infected or they are affected by any of these diseases. So the scope of CSR in health, we have a number of examples of related corporate sectors, hospitals, pharmaceutical industries, health product manufacturers. All these are organizations that could be able to provide corporate social responsibilities. Hospitals, for example, can conduct free medical camps in communities. Pharmaceutical industries are key in terms of distribution of pharmaceutical products, and also insurance companies also come in handy in terms of assisting communities to be able to meet or be able to pay their hospital bills and provide them quality support around their financial challenges. Now, we have quite a number of opportunities for CSR in health. What are some of the things that we can be able to do in terms of corporate social responsibility? Or what are some of the things that we can be able to do as healthcare organizations in order to be able to give back to the society? Number one, we can do what we call health promotion activities. And health promotion activities, we could think about something like health education workshops. So we can conduct workshops to educate the public on various health related issues. We could also carry out what we call community health fairs. So when we carry out these community health fairs, then we could offer free services to the community. Also, we can also do school-based education programs where we train students on healthy lifestyles. All those are promotional activities, and we can go on and on, including nutritional campaigns for people to understand matters around nutrition. We could also have health protection through safety compliance as another area of CSR. And when we are doing that, we could ensure that the community is enforcing food safety regulations. I'm sure every country has regulations on food safety. There are places, for example, or most places in the world, when you need to begin something like an hotel, you need some food safety certifications to show that you are compliant with matters public health and health in general. And also other health protection through safety compliance. We could have things to do with mandatory vaccinations. Those ones are very, very common around communities. The other one is resource allocation for social determinants of health. Now, what we call social determinants of health, they are just conditions in which where they live, and we could be having people that are in situation where they are unable to access quality health care. So, or they may also be having low income levels. And when they have low income levels, then they are unable to access good health care. So this is an avenue for us to venture into as part of our corporate social responsibilities, so that these people that may be underprivileged, they may be having less income, we can maybe come in and see what kind of support we can be able to provide. I've just talked about free medical camps. I've just talked about ensuring that even if they have low income earners, they still have access to the basic treatment of various diseases. And also, we could also, another area that we could focus on in health as part of corporate social responsibility is research and innovation. And we can be able to do quite a number of researches. For example, researches around biomedical issues, where we will carry out research on disease mechanisms. We could also carry research on the development of new drugs. That's very, very important under research and innovation. And also, people are also doing clinical trials. Maybe within the community, we could have trials on how certain drugs are going to work. And also, we could also do research on population health issues, investigate what is the levels of health, or how does health within a particular community, is it okay, or it has some challenges, and how can we be able to improve that particular issue. And then also, as part of corporate social responsibility, various organizations, including health organizations, can also provide support in policy implementation. Remember, we have, for example, policies that would require everyone to have an insurance cover, for example. Policies on what we call universal health care, which would be policies around vaccination. I'm sure you have heard like the vaccination plan for children. Countries cannot just wake up and begin vaccinating children. There must be policies developed across the world within countries, so that that particular activity becomes a continuous and a must activity for every child. Mm. And also we could also participate in CSR activities in terms of policy implementation around matters to do with HIV prevention. I'm sure countries, organizations are doing that. And finally, we could also participate in corporate social responsibilities in health by giving donations to health-related charities. Organizations can come out, give donations. Maybe we are celebrating the breast cancer awareness day or month. Those organizations that are maybe in the treatment of breast cancer, they could participate in health-related activities. It may not really be financial, but they can set up camps for breast cancer testing during that month. That's part of corporate social responsibility, and also providing education for people to understand matters breast cancer. That is part of things that companies can be able to do. Now, how do we benefit when we do corporate social responsibility? How do we benefit as healthcare organizations when we give back to the society? Number one, we gain what we call social acceptance and reputation management. I am glad we have had a lecture on reputation management. So social acceptance is the community begins to see us and accept us by the fact of them saying this is a very good organization. They have come around, they have educated us on matters diabetes, they have done testing, and so on and so forth. And also we could have increased patient loyalty. So patients become more loyal to those organizations that are socially responsible. The other one, we could have employee attraction and retention. Everybody wants to be associated with that particular organization or healthcare organization that is doing various initiatives for the community. So everybody would want to work for those organizations. They would want to remain in those organizations. Retention is about remaining so that you are going to be part and parcel of the success of that organization in all other areas, including corporate social responsibility. Another benefit is when you are doing corporate social responsibility activities, you are able to attract investors and stakeholders. Maybe there are people that are willing to put in money into the business that you are doing. If it's a private healthcare organization, they want to be part of the success of the business. So you can be able to involve them, or they can be able to come on board based on what they see that you are doing. Another benefit of corporate social responsibility is enhancing goodwill and competitiveness. So CSR will put you in a place where you become competitive, or what we call competitive advantage, on you being better than any other healthcare organizations within that particular location. So that's a major benefit. Everybody, of course, wants to stand out. And these social responsibility activities are also avenues for people to market their healthcare organizations. They are avenues for organizations to be known because of a good cause that they did. Another benefit is that government and international recognition. So we will always have you recognized by the government, by international organizations. I have seen countries also run, for example, award ceremonies in matters best healthcare providers. So you could be among those that will receive these rewards because of the things that you have been able to do for the community. Some of them are life-changing initiatives, and you will be able to get that particular recognition. And also because of corporate social responsibility, we are able to encourage innovation and enthusiasm. So we are able to encourage people to be creative in terms of also coming up with CSR activities that people are not aware of, but would assist them. in various communities. You would go to a community and find maybe they have never experienced a kind of an education program in matters non-communicable diseases. So when you set up camp there to explain these concepts, they would really enjoy that kind of engagement. They want to know where you are located. They want to know how else they can be assisted. So even as staff in healthcare organizations, we are invited to always think about innovative strategies to undertake corporate social responsibility initiatives. Now, we have a number of challenges that we are going to encounter in CSR and in health. Number one is challenges brought about by strict regulations. Regulations, for example, that for you to participate in CSR activities or for you to be an healthcare organization, you must meet certain safety standards for products. You cannot just go to a community and the medication, the drugs that you're going to administer have not met the quality standards. Yeah. Remember, that could put your organization in problems. So for you to participate in these events, the aspect of regulation is very, very important. And then, of course, we have regulations that require companies also to disclose their CSR efforts. Tell us what you are doing, the sources of funding for those activities, and so on and so forth. Other challenges would be high standards. You are required, for you as you practice CSR, to adhere to certain set ethical standards. And ethical standards will always go beyond the legal requirements that we know. In terms of services, in terms of the medical assistance that you are given, is it above board? Or you are just given because maybe you have realized you have some drugs that are on the verge of expiring, and then so you just rush them to CSR activities so that you can do away with that stock. Yeah, that may not be the right way to go about it. So companies are finding it difficult because there are certain standards that you have to meet in social responsibility activities. So those standards could also mean you need to have also practice fair labor practices for employees and so on and so forth. And finally is the challenge on cost considerations. Remember, when you tell people that a medical camp is free, it is not free on your end. You have to incur a number of costs. If you are doing it on tents, if you are bringing doctors there, you have to maybe pay them some allowance for that day's activity. So CSR becomes challenging because organizations that may not have finances for that particular work, they may feel it difficult, maybe to pick on their very little profits to do CSR responsibilities. But ideally, it is all about sacrifice. It is all about organizations sacrificing just some little finances to be able to finance these activities, because to the community it may look free, but on your end there are some costs that you have to incur. We have a number of CSR activities in healthcare that we can be able to engage in. These activities would be, for example, financial and technological support for healthcare access. So that's very, very important. So you need to be able to gain or have financial and technological support. Without that, then CSR activities might become very difficult. And then also we could have integrated healthcare delivery through partnerships. For us to undertake CSR activities, we can also partner with other organizations that are going to provide support, or maybe in terms of offering that particular CSR activity, they are good at it. I'm sure you have had a country like India very much praised in terms of healthcare. So an hospital will partner with doctors in India, maybe for some few days. They would travel to that particular country, to that particular community, to be able to provide support. So CSR activities work even better when we have this kind of partnerships. And then also we need to address demand supply, much in public health. That is very, very important. And we do that by undertaking data analysis and forecasting. Maybe we can look at various health trends, and we could also conduct comprehensive need assessments to so that we don't just go set up something in a community and it does not receive the reception that it should be able to receive. We could also look at community partnership on health issues. So we could partner with smaller healthcare organizations, dispensaries around a certain community. We could also partner with community leaders. Remember, they know the community better. They know who is where, who is maybe sick. So those we cannot maybe get into a community and we do not have these particular partnerships. So the leadership of a community, the community itself, we need to partner in that they are going to feel that these guys have come around and they have been a benefit to us as a community. And then also organizations can be able to support in fundraising activities. Yeah, so sometimes within the community we need to raise some funds. They could partner in that. Maybe it is on matters, some medical care of an individual. They could also be volunteering in health campaigns and organizational camps. I have mentioned about that. We could have different campaigns, like I talked about campaigns during the Breast Cancer Awareness Month. Organizations that deal with breast cancer can participate in those campaigns. Free medical camps if you are able to do it. And finally, you need to be able to collaborate with health institutions and organizations in order for CSR activities to be successful. Now, we have something we call corporate legitimacy. And when we are talking about organizations being legitimate, remember, corporate could be companies. In terms of legitimacy, then we are talking about an organization's perceived credibility and trustworthiness within the industry. So what does the community think about you? So in terms of you being accepted within the community, that's what we call corporate legitimacy. And we have a small example here in terms of a company that listens to their communities who are not in line with using palm oil. So it is important for us as organizations to, as we also undertake corporate CSR activities, these activities being accepted in the community. And are our services in general being accepted by the community? How do they perceive when they hear organization X within a particular community? What do they think about us? When a particular health facility, hospital is mentioned, what does the community think when that particular hospital is mentioned? Sometimes you will maybe be inquiring to go for a certain medical checkup, and then you mention a certain hospital and somebody tells you that hospital is not very good, and they give their reasons. So it means in terms of corporate legitimacy, something is not right. Now, when you gain or when you have corporate legitimacy, you are going to benefit as an healthcare organization because you will have your reputation enhanced or better reputation. You will be able to build trust and credibility on various activities. We will also benefit from what we call patient loyalty. We said those particular patients that you serve or the customers that you serve, will always repeatedly come back for your services or for goods that you distribute. So that's very, very important. And also in terms of corporate legitimacy, you are also able to gain investor confidence because of the work that you are doing. And you are able also to gain competitive advantage. When you gain competitive advantage, it means that you simply have an upper hand compared to other competitors. And we have repeatedly in previous lectures gave an example of what we call Mayo Clinic. This is a healthcare provider and a research firm that has gained corporate legitimacy because of the healthcare services that they offer to people across the world. So let us all strive to gain corporate legitimacy as organizations. Let us also build a relationship that people are going to feel that we are a positive impact in the community and in a country and also across the world. Like I would also say that in terms of treatment, maybe we could quote India as a country that in terms of treatment, they have gained corporate legitimacy. Every day, every now and then, people are leaving their countries to go for treatment in this particular country. So how did they reach there? There must be some very nice things that they are doing that are enabling them become corporate legitimate or enabling them to be viewed very good in terms of treatment in the eyes of people across the world. So it is something that we need to think about and see how we can be able to move forward in terms of ensuring we achieve it. Now, we have a number of community relations programs that we can be able to engage in as organizations. Number one, there are things to do with philanthropy. And this is when you as an organization or person running an organization, you are able to donate to local community causes or charities. So those donations, I said it is not all the time that they are financial. They could be, you are also providing some form of medication that would be important to the community. That is part of philanthropic work. And also this kind of a strategy is considered the lowest degree of commitment to the community. So anybody can do it if they are so willing to be able to do it. Another community relation program that we can be able to run as a company is volunteering. So we can come up with the employee volunteering programs. And the purpose of these programs is to be able to build relationships with communities. They will of course get to know you better. They will get to know what services or goods you are selling and so on and so forth. And we are also saying this one is considered to come with a relatively high commitment for the organization. Like I said, when we are running these things, even if they are seen from the community eye as volunteering, we might of course incur some costs. And it is something that we need to be able to willing to do so that we can build relationships with these communities. And they can always accept us when we are coming back for any other programs. Another community relation program is in relation to various partnerships. So it's a highest level of engagements which is achieved with partnerships. So there are long-term efforts in helping communities address education, infrastructure, and welfare issues. So you can have partnerships. I've seen organizations that have partnerships that every year they are running a program, maybe for heart surgeries, maybe for children, and that has become their CSR activity. Every year they are running it. So they have partnered with the citizenry, they have partnered with the community to be able to offer this activity. On matters education, it could be general education where as an organization you want the community to have educated people, or it could be education based on what I talked about, based on specific non-communicable diseases. Maybe they need to be more aware about them and how to conduct themselves in case somebody has a similar disease. Infrastructure, we have companies that are willing to put up what we call access roads within communities, communication networks, and so on and so forth, just to make sure that the community also develops. And welfare issues, we could be having issues that are affecting people within the community. They are not able to finance some healthcare related issue. You will always see a company come out and say, because that issue maybe was raised in the media, they say we will support that particular child for treatment. And those stories are all over across the world, of people that are somewhere and they are unable to access certain medical treatment. But once that information is put to the public, a certain healthcare organization will be willing to come out and provide support and partner with that particular person. Foundations, we are saying they represent the most extreme type of partnerships. So organizations can have foundations, support organizations that are going to assist them to be able to relate with the community through the programs that we have just mentioned. Now, in corporate social responsibility, the aspect of communication is also very, very important. And we have different ways of communicating that we could adopt on matters social responsibility, or CSR. Number one is what we call informational kind of communication. By this, as an organization, we are going to seek to share relevant information and updates and various achievements that we have been able to do as an healthcare organization. So the key focus is to inform people about something, and it is a one-way symmetrical model of communication. So that simply means the major communication is coming from the organization to the publics. And the purpose of doing informational kind of communication is it is going to ensure we have continued stakeholder engagements. It is also going to ensure that we have regular updates and reporting to the community. And that, of course, like we have been discussing, it puts us on a way different new level because information is out there on what we are able to do. And then also we have another method of communication, what we call persuasive, where we are going to attempt to change the tune stakeholders' knowledge, attitude. We could have stakeholders that have maybe negative attitudes towards us. So once we do persuasive communication, we are still telling them that we are still around. Maybe it's a mistake that we did. I did emphasize on the need, if you realize there is a small mistake that has led to negative publicity, for you to be able to apologize and be able to move on with the community. So it is also a two-way asymmetrical model. So once we are doing persuasion, we also need to see the reaction of your audience. Are they convinced with what you are telling them? Another strategy, we could adopt the strategy on dialogue. So organizations and stakeholders will mutually engage in exchange of ideas. So they will have to communicate with one another. And we're also saying it's a two-way symmetrical model. So when we are having dialogue, everybody, the organization participates, the stakeholders participate, and definitely that is going to put us into a good place in terms of social responsibility. Now, when it comes to CSR advertising, that means that companies need to be socially responsible when they are giving information to the public. And CSR is a major tool when it comes to advertising. and through it we can be able to highlight company initiatives. Through it, through CSR responsibilities or advertising, we could be able to also build on our brand reputation. And of course, this is going to contribute to revenue growth. And also, companies are going to more believe the information because they are repeatedly seeing it out there being disseminated by a particular company. We have something in social responsibility that we call greenwashing. Now, this what happens in greenwashing is we are saying that more efforts are made to advertise CSR activities than implement them. So what happens in greenwashing as a form of passing information in regards to CSR, companies will just be exaggerating and falsely giving claims on them being committed to a particular CSR cause. And of course, this one is going to contribute to reduced consumer trust. So what really happens, I could be having an organization that is really a champion of breast cancer during the maybe breast cancer awareness month, but on the ground, I am doing nothing. I am just seeking some sympathy, yeah, and people maybe to see me as a very good organization. So that's called a greenwashing, and companies are doing that. They are doing that by, for example, having misleading labels or certifications. So you could have a product and you just put a misleading label so that people can buy it. But in the real sense, even what you have said, maybe it's going to treat, if it's a drug, it's not able to do it. And also, companies would also do irrelevant marketing activities, and also they could be able to provide incomplete information for various things. All that is greenwashing. We also have something we call pink washing and rainbow washing. So when it comes to pink washing, organizations will be using breast cancer awareness colors for PR purposes. So remember the color pink. Organizations would be using that maybe to show that they are together uh, or they are part and parcel of that initiative during the breast cancer awareness month. So that's called pink washing. But ideally, their efforts are what we call insincere. They are not real. And you will find these kind of companies that their actions are going to contradict their professed commitment to breast cancer awareness. An example of what we call pink washing is when maybe a fast food joint is going to promote a special pink menu during the breast cancer awareness month. But ideally, that's not what they do in the other months. They would be very famous in terms of offering unhealthy food options. But because it's a breast cancer awareness month, they decide now, let us have something that is pink related in our menu, including the colors. Now, of course, we have food colors and we can be able to do these things. We can have pink cakes. We could have uh, food that are spiced with pink colored spices. So we could also have other organizations that have pink themed merchandise. But when we look at the profits, once they sell this merchandise, it does not go to any cause related to breast cancer, but it goes to them as part of the profits that they have made. Now, the reasons why some companies are doing pink washing, we may ask, is number one, they are just seeking for emotional appeal. They want to evoke strong emotions. You know, anything cancer is very emotive. So they just want to take that very short opportunity or during that particular awareness month to seek for emotions and to tell the communities that we are together. But ideally, practically, they are not there. Others would maybe be seeking to cause some distractions. Maybe they have experienced some negative publicity. So it's a breast cancer awareness month or awareness of any other disease. They would now take advantage maybe to try and cover up something that negatively happened. And they also want to show consumers and citizens that they are committed. But ideally, they may not be really committed to those causes. Besides pink washing, we have another thing called brainwash or rainbow washing. So when we have rainbow washing, organizations are using pride events for PR purposes. Of course, rainbow colors are associated with LGBTQ. So companies would take advantage of those colors and maybe develop merchandise also that are rainbow colored. But ideally, those profits do not go to that particular community. So there are things that we need to be aware of. We need to avoid because ideally, when you are doing any of these wrong things, they are going to catch up with you at some point. So the best thing is to try and avoid such kind of issues. The other one is about CSR communications. There is need to existence to include stakeholders in CSR decisions. So when you are communicating, what is the role of stakeholders in part of the communication we are making? And we also need to embrace dialogue as part of CSR communication so that we are not just leaving the company to go set up medical camps, for example, and you have not dialogued with the community to find that whether this thing would be beneficial to them. So dialogue is key. We did mention it in one of the slides. We are also going to discuss about what we call sustainability in healthcare. Now, we are saying it's the balancing environmental, economic, humanistic, and social aspects in the provision of healthcare services. So, sustainability simply is all about ensuring that the healthcare services that we are offering continue to last for a long duration of time. And it is also able to meet the environmental standards, the economic standards, what is the cost of health to the community, and so on and so forth. And we can be able to do that by what we call long-term value creation. So where we achieve corporate performance while optimizing resources. Optimizing is all about maximizing. So we can create value in terms of the services that we are offering and also benefits of sustainability. Once we have created a long-term relationship with the community, then what is going to happen? We will find ourselves, we have expanded as an healthcare organization. Stakeholders are also going to find value in the organization, and also we will be successful in terms of talent acquisition. Talent acquisition means everybody would want to work for that organization that is sustainably providing healthcare within a particular community. Now, we have various areas of application of CSR, sustainability and ethics in hospitals. So where can we put into practice our CSR activities? So we look at the aspect of hospitals as corporate entities where they are going to be delivering healthcare services that are of high quality and have also met what we call ethical standards. And we are also changing how hospitals are managed. When you look at various healthcare facilities, you realize that the topmost person there, also in terms of the levels of education, they are not very mean people. They are very well qualified, maybe in matters management, maybe senior doctors who are also consultants. So things are changing. We are moving from situations where just anyone is running the healthcare organization We want quality services. And by the virtue of the person that we have on top, it is going to determine how successful we are going to be in terms of hospital management. Now, there are various social responsibilities that we can do in healthcare. Number one, we want to ensure that we continue to offer quality and relevance of care. That's key for every person, matters quality. Quality in terms of services, quality in terms of treatment, and so on and so forth. And also to be able to improve accessibility of care in terms of cost. Remember, across the world, the issues of cost of healthcare are quite expensive. So it is something that countries need to think about to be able to assist their citizenry. If we look at the numbers of the people that are traveling to India every day, it is to do with matters to do with cost. So part of social responsibility is to see how accessible care can be. Waiting time is also very important. Sometimes you will visit a facility and you end up spending the rest of your day there. So it means there is a challenge in terms of waiting time, and something needs to be done so that can be resolved. The other one is compliance with regulations and labor laws for us to continue to survive as healthcare organizations. Then there are regulations that govern us in terms of licensing, in terms of personnel, and labor laws. Labor laws are laws related to employees and employment. Are we adhering to them? And every country has their own labor laws. What do they say, for example, in terms of the minimum wage for health workers, in terms of leave days? Those are things that we must adhere to every day as part of social responsibility. And also, the other one is the provision of community support and awareness. That's very important also. And finally, job creation in healthcare. We have very huge numbers of unemployment. So what we can be able to do as healthcare organizations in terms of job creation, we need to do it so that besides the community seeing us as an healthcare organization, they can also benefit from jobs that have been created. It's not a must that they be very big jobs. Even casual jobs for people that are going to be cleaning the organizations could maybe be given to the community. That's part of social responsibility. Now, in terms of ethical considerations, we have a number of things that we need to do. Number one, we need to provide care irrespective of a patient's ability to pay. This is a major problem in very many countries, and it is upon us to think on what we can be able to do. There are facilities where people have lost their loved ones because the facility is saying, for example, before we begin any kind of treatment, deposit this number of dollars. So we need to see whether we are ethically right. Is it right for someone to lose their lives because of the name of you depositing some funds? So that has some element of being very unethical, and it is something that organizations, healthcare organizations, and any other form of organizations need to think about. If I'm coming to seek a certain service, I've also seen situations where somebody has lost their loved one, then the hospital is retaining the body because of a huge medical bill. And those are the things that we are saying, even as the world, different countries, we need to think about that particular issue. So the other one is equity in delivery of healthcare. Part of being ethical considerations are the good things that you need to do. So in terms of equality, in terms of the healthcare that you are receiving, we need to make sure that it is perfect and it serves everyone equally. And finally, and very, very important, as part of ethical consideration, or as part of the things, very good things that we need to do as organizations, is the need to safeguard patients' data and privacy. Yeah, so patients' data is very, very confidential. We need to be considerate and not to release this particular data to the public in the name of maybe seeking some PR milestones. We need to be able to avoid that. Now, in terms of environmental sustainability, there are a number of things we can do. Number one, we need to ensure our healthcare environments are safe. Number two, responsible waste management. You can imagine a healthcare facility that is having a very poor disposal in terms of syringes, in terms of used drug bottles. Finally, it could contribute to other health issues within the community. If somebody, for example, steps on an injection that maybe injected somebody with a particular disease, because of poor waste management, then it means now we are not doing it very well in terms of waste management. So I'm sure we have policies on waste disposals, waste management to ensure nobody contracts a disease because of improper waste management. The other one is regional water and energy consumption. We need to ensure that we are doing that correctly, and also promote transparency in various health practices. And also finally is to be able to be sustainable in terms of supply chain practices. So sustainability, I've said, it is the continuous survival of something. So supply chain practices would be practices around the supply of drugs within a particular community, within a particular country. We do not at any point intend to experience any shortfalls or lack of drugs because our supply chain has a number of issues that need to be addressed. Now, in terms of economic sustainability, there are a number of things we could do. Number one, we can adopt technology for quality care and reduction. So nowadays we are now moving to a way new world where institutions, healthcare organizations are able to acquire very sophisticated and very important machines to ensure quality healthcare. So it is something that we can do. And of course, we also need to ensure if we have these kind of facilities, they are also cost effective. People can be able to afford those machines. And the other one is addressing preventable and chronic diseases to reduce costs. So that's very, very important. And then we need to support healthcare workforce. By support, we mean we can give them protective clothing, we can give them good pay and salaries, and so on and so forth. And the other one is efficient resource utilization, e.g., we need to minimize single-use reprocessing devices. So all resources that we have, we need to ensure efficient utilization. The financial resources, the human resources at our disposal, and so on and so forth. And finally is part of economic sustainability. We need to boost the local economy through local product procurement. That's a major one. As part of growth of the economy, we could ensure part of our supplies or part of our raw materials, we are sourcing them from within a particular country, or within a particular community. And of course, when this money is pumped into the country, into the community, they are able to economically grow and improve themselves. Now, for us to be able to implement CSR and sustainability and ethics, number one, we need leadership commitment. Mm. This is a major one for successful implementation. So, what are the leaders of the organization thinking in terms of corporate social responsibility? Are they in support of it? Mm. And the other one is we need also to think about the role of hospital workers at all levels. When it comes to issues about employees, every employee is very, very important in an organization. So for us to also succeed in CSR activities, we need to begin from within, that no one feels discriminated. The other one is ethical dilemmas and cultural change. We could have our CSR activities being hampered by whether we are thinking whether it's right or not. Like the example I gave about the rainbow washing and LGBTQ. So you could be torn about are you going to serve this community or you are at crossroads. That's what we call dilemmas. So that's very, very important when it comes to the implementation of CSR activities. We have a number of CSR frameworks that guide countries and institutions. And we are saying frameworks are simply models or guidelines that are going to help organizations to align their social and environmental goals with the organizations of the objectives. So some of these framework include the UN Global Compact, the ISO 26000, we have the Global Reporting Initiative, we have the B Corp satisfaction or certification. Those are the ones that are now highlighted here. Now, when you talk about the framework for the UN Global Compact, this is a framework that was launched by the UN, and it meant to encourage businesses and organizations to adopt to sustainable or sociable responsible policies. And through this UN Global Impact Framework, it is aimed to provide support to international proclaimed human rights. For example, when it comes to matters workforce and employees, we can be able to eliminate all forms of unfair labor practices. So these frameworks are just meant for organizations to know the minimal expected standards in terms of their conduct on matters corporate social responsibility. Then ISO, of course, stands for International Organization for Standards. So this particular ISO is simply an internationally recognized guideline on matters social responsibility. So it sets guidelines on how organizations need to carry out their social responsibility activities. Part of the emphasis that ISO 26000 emphasizes on is to be able to be accountable, be able to be transparent, ensure better ethical behavior are practiced, also have what we call stakeholder engagements in terms of your CSR activities. These frameworks are also frameworks that you could also research on, get to know more about the UN Global Impact and the other list from the previous slide. Find out more to be able to broaden your knowledge on the same. The ISO 26000 will also cover various aspects in terms of social responsibility, how you are supposed to do it, matters to do with human rights, various labor practices, and so on and so forth. So features, I've just mentioned about them, and it guides on how organizations can have corporate social responsibility as part of their strategies. And it applies to all organizations. That's what we are saying in dot number 2. No one is excluded from this kind of a guideline. And it will also encourage stakeholders, including employees, customers, to address social responsibility issues. And it will also emphasize on transparency. I had mentioned quite a number of that. Then another framework is what we call the Global Reporting Initiative. This is also a very widely used framework for sustainability reporting. And the key emphasis on this framework is that it sets guidelines and principles for organizations to report their economic, environmental, and social performance. So these particular standards will help organizations communicate their sustainability efforts. Yeah, so it's a very, very important framework also. And it is simply pushing organizations to be very transparent and accountable in terms of the information that they are giving out. So we have a number of features. So it pushes for sustainability reporting, good ways of governance. It pushes for ethics, that whatever that we would be practicing is ethical for everybody to be able to adopt. And also it pushes on the ideas around good human rights. So organizations through this particular GRI reporting are encouraged to measure, manage, and report their sustainability performance activities. These frameworks are very, very important as we undertake CSR activities. They are important to be able to understand them because they will assist us to do it right and to be successful. Then we have what we call B Corp certification. So this is a form of certification that is awarded to companies that are able to meet specific social and environmental performance standards. So it's like a form of appreciating that organization that has been able to meet social and environmental standards. So examples, we could be having examples of companies that we could say that they are B Corp certified. We have a company that is called Ben and Jerry's, and this is a company that is famous for a certain ice cream brand. Of course, that one is a general company. In terms of an healthcare organization, we have a company we call Dama Merchant Services. These ones have been given certification because of the provision of payment processing solutions for healthcare providers. So they came up with a payment solution that has been able to assist healthcare providers. Of course, when you do something that stands out, then you could also qualify to be able to receive what we call B Corp certification. So it's simply a certification for appreciation because of the work that you are doing in the community. So some of the features of B Corp certification, we have said they look at the impact of their decisions and not only to stakeholders, but also to employees, customers, and the community. So if you are seen that you have made an impact, then you could receive this certification. And for you to receive the certification, of course, they will be able to look for your overall and social performance, including governance. How do you treat your workers? How do you engage the community? Those are some of the considerations. So it is not for everyone. This certification is not for everyone. It is for that person or that company that has met the things that are listed here. So if you are not, maybe in terms of labor practices, treating your employees well, then it may be something that you cannot qualify for. So the key thing is for us to strive to have this certification. Now, we have a number of corporate social responsibility tools that we can incorporate for us to be able to measure, monitor, and improve CSR performance. So when we are doing it, we can use a number of strategies. We have what we call a balanced scorecard strategy. This one will be used to measure and manage our CSR performance activities. We can use it, balance scorecard, to be able to measure revenue growth. Through it, we can also understand patient feedback surveys So it's a method that is very key. And we're also saying that through the balance scorecard method, companies are able to assess their social and environmental impacts within the community. Another method is that we can use to measure our corporate social responsibility activities is what we call stakeholder analysis. So through this method, we can be able to understand various individuals, groups, organizations within that have various interests. So through this stakeholder analysis, then we will get to know our stakeholders as an healthcare organization. For example, we'll get to know who are our patients, who are we serving, healthcare providers within a particular jurisdiction. We get to know them. We get to be in a good relationship with governments. And we also get to know various healthcare players, for example, insurance companies, because we have done stakeholder analysis and we understand the stakeholders. Last but not least is the social return on investment. Uh, this is a particular very good method that is used to assess and quantify the social environment and the impact that our social responsibility activities have been able to generate to the community. And for example, we could be able to identify benefits that have been resulted in healthcare initiatives. So social return on investment is to ask ourselves, we went out and did a medical camp. How are we benefited as an organization? And we set out some interventions, maybe during the COVID-19. How did we benefit as an organization? So a return on investment is what you get back once you do a social responsibility activity. And finally, we could do what we call a life cycle assessment. This is simply a tool that we are going to use to also it could be a certain drug that we have issued. So we could use is responding to the community. And this kind of analysis will also help organizations to identify areas where they can reduce environmental harm. Maybe we have realized we are causing some environmental issues. Maybe on how we can be able to reduce our carbon emissions and also minimize resource use. So we can adopt either of those four methods to be able to assess the impact of our social responsibility activities. So any person who has a comment that is going to bring us to the end of the session. So you are welcome to make a comment or ask a question. So if there is no comment, we can call it a day, and we hope to be able to meet you soon for another session. So enjoy your evening and have a good night.